Hello and welcome to our channel Study Medicines. If you are looking to become a doctor, or your aim and ambition in life is to become a doctor, and you are confused about taking this decision or degree, this video will definitely help you. At the end of the video, if you like our video, please subscribe to our channel and share our video. Let's move on. This video is brought to you by the YouTube channel Study Medicines. Let's take the first things first, how becoming a doctor works. In this video, we'll take you and give you an inside look at obtaining a medical degree and becoming a practicing physician. First, we will tell you what things you should have inherent so you can become a doctor, successful doctor. To be a doctor or not to be, if this is the question in your mind, we will tell you should you continue with your aim and ambition or not. Here we give you three important counterstones of a successful career in medicine. Number one, you should have love for learning in general. In MBBS, you have to learn in and out of the human body and other medicines as well. So you should have a love for learning in general. Number two, a true intellectual curiosity about medicine in particular. If you do not feel like studying medicine, you should not go for MBBS, because there should be an intellectual curiosity in a person to opt for any medical career. Number three is very important. You should have a strong desire to help others. The third one is very important because a doctor throughout his career and throughout his practice has a single motive of helping others in curing their diseases. So this is very important out of the three. All three are important, but this one is very important. If now you can decide basis on these three features, these three important steps rather, you want to become a doctor, you should have these three. We have actually from almost hundreds of things, we have summed it down to 3 points only. So this covers maybe all of the things. If you think you fit into these three, yeah, you should definitely go for this profession. Here we give you the pros of once you become a doctor. So what are the pros of becoming a doctor? Medicine as a career is filled with choices. What are those choices? You can do research in whatever specialty you choose, whatever specialty you choose, with the potential to make a real breakthrough in preventing or treating illness. Medicine is a career that is honorable and is held in high esteem. So we're talking about pros here. So this is an honorable job definitely, and you will always be held in a high esteem. So there is a lot of job security plus a handsome salary at the end of the day. You have a handsome salary, you can also start a private clinic and start earning there as well. So there are also some cons associated with it. I will not be focusing on the cons. If you already have made your mind that you fit into the first part of the video. So cons still we will discuss. This is the cons. Lots of education expenses in terms of the fees. Plus, once you are done with your MBBS, you will go for an internship, and during your internship you may be an employee of some hospital, but during internship you will be unpaid and employee. Large amount of money spent on insurance and malpractices. You have to have a long hours of duty, being on call, etc., etc. See, if you want to reap a good cultivation at the end of the year, you have to work hard in your field. So these cons, if you see, I see as that your hard work. This is your hard work. This involves your hard-earned money. This involves your time. This involves your patience. But at the end of the day, you will have an honorable job. You will be held in a high esteem. You will have an attractive salary. That's it. Let's move to next part of the video, which talks about the curriculum. Generally, the first 2 years are classroom based, with patient contact beginning in the second year only. The third and the fourth year consist of rotations through the different major specialties of medicine. We talk about the first year framework. One first year medical school coursework, you will study anatomy, physiology, histology, biochemistry, embryology, pathology, numerology, and pharmacology. So all these subjects you will study as a classroom training during your first year of MBBS. Uh, so are do the grades matter? In some college this definitely matter. This only the only thing matters is the hard work that you put in your during your course. Many medical schools use a pass fail system instead of the traditional ladder system. This system tends to reduce competitiveness, but it depends individual to individual. If you have a good aim in mind, you should not focus only on grades. You focus on other things. Learning is most important part. However, this system it also encourages learning for learning's sake. However, this should not be the case. You should learn because for the learning only. Let's move to the specialities. What are the specialities you can do your course in? You can opt for any of these courses. That's anesthesiology. For this is the duration we have given at the end of this the course. The anesthesiology, you have a 4 years course. Dermatology 4 years. Emergency medicine 3 to 4 years. General surgery 5 years. Internal medicine 3 years. Neurology 4 years. Obstetrics and gynecology 4 years. Pathology 4 years. Pediatrics 3 years. So once you are done with your degree, so next thing you will be looking for is the medical license to actually go into the market and start practicing. So after completing a residence or a fellowship, you must obtain a medical license so that you can practice medicine. Each state has its own individual rules. You need to have passed one of the several exams to prove that you are competent. Letters of reference are usually required. A check of your malpractice history will also be obtained. So in order to get a job and start practicing, you need a medical license. Let's move on. So once you're done with the medical license, you move into the real world. You will face, now here we will give you what opportunities you will have in your hand once you're done with the MBBS. However, there are other courses which are added to the MBBS with like MD and MS, but you can still start practicing just after MBBS. So you can join a group practice or start your own private practice. You can join a clinic. You can join a HMO. Some physicians are hospital-based, emergency physicians, radiologists, pathologists, and anesthesiologists, but can be part of private practice or an employee of a hospital. So this is the real world practices. So by now you should have made your mind whether you want to go with the option of becoming a doctor. If your aim is now set after watching this video and you think this was helpful and you were able to make your mind whether to go with your aim of becoming a doctor or whether not to go with it, please leave us a comment what you feel after watching this video. So that brings us to the end of this video. We thank you for watching this video, and please, if you have liked our video, please subscribe to it by clicking on the icon at the right bottom of the screen. Thank you for watching this video.